Before coming to the hospital, it is important to set up your home so that your daily activities will be easier and more comfortable after your surgery. Be sure that your home is well lit and free of clutter, any tripping hazards. Remove all throw rugs, tuck away electrical cords, and organize your living areas to avoid excessive lifting, bending, or reaching. Arrange frequently used items like clothing and toiletries so that they are in easy-to-reach places. Consider preparing a bedroom area on the main living level or near a bathroom for short-term use upon returning home. It's important that you have a clear, well-lit path from your bedroom to your bathroom, free of any furniture. Next to your bed, keep a charged flashlight for emergencies and place the telephone or mobile phone charge in a convenient area. In the bathroom, you can consider installing fall prevention equipment such as grab bars or skid-resistant mats. In the kitchen, store heavy and frequently used objects at or above waist height. Consider moving items in the lower part of the fridge to a higher shelf. Be sure to prepare food or purchase easy-to-prepare foods before coming to the hospital. To help make your recovery as smooth as possible, planning should begin well before your surgery. Following these steps will increase your comfort and safety in your home when you return from the hospital. We wish you a successful recovery.